Hello, everyone. I'm Dr. Richey, and I'm sharing another video on NCLEX questions and how to read them. This time, we are going to be on our priority of breathing. If you have not seen the other video of airway, please check that out. All right, let's go ahead and start diving into this. All right, now, when it comes to breathing, um, with our priorities, we're going to start breaking down the questions as we had always done in the past. If you haven't seen those videos, please take a look and see them. All right, so for this question, we have a 55-year-old male patient who is admitted to the emergency department with shortness of breath, wheezing, and cyanosis. The nurse assesses the patient and notes a respiratory rate of 28 breaths per minute, use of accessory muscles for breathing, and diminished breath sounds bilaterally. Which of the following interventions should the nurse perform first? Remember, when it comes to the NCLEX questions, we're going to read the entire question just to get an overview. Then we're going to start breaking it down, right? All right, so we have a 55-year-old male, which we definitely want to know the age and gender, because we're going to possibly treat a female different than a male during our assessments and treatments, possibly. They're admitted to where? The emergency department. We got to know where the setting is if it's available. We're going to do things different in the emergency room versus an ICU versus a home health situation or even possibly med surg. All right. And they were admitted with shortness of breath. Right here, this is starting to tell us that, okay, we might be moving into a priority, and if so, it's probably going to fall under the B when it comes to this. Wheezing and cyanosis. The nurse assesses the patient and notes a respiratory rate of 28 breaths per minute, use of accessory muscles for breathing, and diminished breath sounds bilaterally. All right, so if we're in the nursing process through here, obviously we are in the process of A for assessment, right? It even tells us. I love it when NCLEX points that right out. All right. So obviously right now we're starting to get a little concerned because we have a respiratory rate of 20 breaths per minute, 55-year-old male. This is going to be a little excessive, right? Normally respiration rates are between 12 to 20. If this would be a child or an infant, especially whenever we have pediatrics, not so much an infant, scratch that. 28 breaths per minute wouldn't be that big of a concern, but for a 55-year-old man, definitely concerned. Obviously, we're going to be concerned with diminished breath sounds. Now, which of the following interventions should the nurse perform first? In the process, we're definitely in the intervention stage, right? Okay, so let's take a look at our answer selections. We have administer a bronchodilator as prescribed. Well, that's definitely an intervention, right? Okay. Obtain arterial blood gases, or ABGs, for analysis. Okay. Apply oxygen via nasal cannula at 2 liters per minute. This definitely would be for breathing, right? Place the patient in a high Fowler's position. Okay. 28 breaths per minute. They're using accessory muscles. They have diminished breath sounds. They're cyanotic. This stuff's all bad, right? All right, so we're going to get rid of the bronchodilator right away and the ABGs right away. Not that they're not important, but this is a priority question of what should we do first. Now, applying oxygen, 2 liters per minute. Is that going to help with breathing? Yeah, we need to get more oxygenation through the body, right? Place the patient in a high Fowler's position. These are both pertaining to breathing, right? Why would putting somebody in a high Fowler's position help with breathing? Well, think about it. If we're laying flat, we're going to have a little bit more pressure of gravity pushing down on us. And normally for us just laying there breathing normal, that's not a bad thing. But if we're already starting to be in some distress and we're laying down, that little bit of pressure of gravity is going to affect us even more. So if we move the person into a higher Fowler's position, what's going to do with the patho of the body? It's going to make it easier for the chest to expand and contract, right? So it takes some pressure off the diaphragm because the diaphragm can start to go down lower and then shift back up, right? So high Fowler's could definitely be a good thing for breathing on this too. So we definitely haven't narrowed down between C and D. What do you think the answer selection is going to be? If you pick D, place the patient in a high Fowler's position, you are absolutely correct. Not that oxygen is not important. It is, especially in this case. However, what is the first thing we want to do? We want to get that patient up. Get them in a high Fowler's position, because even if we apply oxygen when they're laying down, the oxygen is going to help, but they're going to get more oxygen into the bloodstream and stop being hypoxic when we set them up, because it's going to allow the oxygen to work more effectively and efficiently if they can actually expand and contract their muscles a little bit easier, right? And that diaphragm, get more air into the lungs and have more space. Here's the rationale. The priority intervention for a patient experiencing acute respiratory distress is to improve ventilation and oxygenation. Placing the patient in a high Fowler's position helps to maximize the chest expansion and facilitates easier breathing, as we went over. While administering a bronchodilator and applying oxygen are important interventions, positioning the patient to optimize breathing should be done first. Obtaining ABGs is also necessary, but is not the immediate priority over the ensuing adequate ventilation. All right, hope that makes sense. Now, if you like these videos that I'm doing, or if this is the first time you're showing up to see this video, thank you so much. Please remember to, of course, like and subscribe so you can get more videos and know whenever I have videos coming back out again that's new. Please share this information, especially if you like it, so that we can help as many people as possible by spreading the word. And please leave me a comment. Let me know if you're liking these series of videos that I'm doing currently, or if you're not. I will tell you I'm planning on starting another series of videos. This is going to be pertained to anyone that's going to be starting nursing school, as nursing school is starting to ramp up here pretty soon, at least in my area. It's going to be about the second to last week of August. So if you're getting ready to either enter into nursing school or know somebody's going to be entering into nursing school the first time, please have them check out these videos. Encourage them to reach out to me, because I actually have a program that I'm going to be designed where I will help everybody go through the nursing program and process every step of the way and work with everybody one-on-one. So the other thing is, if you are getting ready to take your NCLEX, or if you have taken your NCLEX and haven't passed for various reasons, please reach out to me. I will definitely do whatever it is I can to assist you. And as it stands right now, I still have this special course that's running right now for a express crash course in 4 weeks to get you comfortable and being able to take your NCLEX confidently and pass it. I did have 10 spots. Currently this month, I have about 5 slots left. So if you're interested, please check out the links and reach out to me. Until then, happy studying, and I cannot wait to hear some information, and hopefully I'll be able to help some of you reach your goal of becoming a nurse. Thank you.